Hi everybody, welcome to today's video where I'm joined by Lee Cunnell, a dual registered nurse and paramedic with nearly 40 years in frontline practice, education and leadership. Thank you, Lee, for coming today. It's wonderful to have you and for you to give your time. So I'm just going to read out a little bit of your bio.
Okay.
So Lee began his career as a nurse in Ipswich before becoming one of the early paramedics in the UK. And his work has spanned hospitals, urgent care and emergency care, and community response. So it gives him a rare dual reg insight into how care is delivered across our healthcare systems. Lee has led in higher education in the NHS, shaping the development of registered nurses, paramedics, and healthcare support workers. And he now focuses on apprenticeships and workforce development, helping to prepare the next generation of skilled workers. He's known for his calm presence and person-centered approach. He brings a strong belief in dignity, humility, and authentic leadership in healthcare. And so I'll welcome you again. Thank you so much for giving your insights today.
You're very welcome, Carol, and thank you. Yeah, thank you for having me along. I'm very pleased to be here. Yeah.
So, Lee, I thought we'd start with you giving an overview of your really interesting career pathway and dual registration. And I know there'll be a few nurses out there watching who might want to become a paramedic later, or they're just anyone interested in that career pathway, that paramedic role.
Yeah, of course. Yeah, thank you, Carol. Clearly I've been knocking around a very long time. Next year, it's 40 years. So it's not surprising I've done quite a few things, I guess. But yeah, having the dual registration has been super helpful. In I think it was the April, maybe the May, but in 1986, I first entered Ipswich Hospital, and that's where I started my nursing journey. Trained as a nurse there, and then I became a paramedic in the early 90s. So I joined as an ambulance technician, and then I became a paramedic, and I spent 27, 28 years doing that. And a variety of roles, sort of officer roles. Something I'm very proud of is we were quite an early adopter for rapid response, and I was part of that project that got that off the ground. And then I managed that team across the 3 counties of Suffolk, Norfolk, and Cambridgeshire. So yeah, and that was lovely. And then I'd done that for a while. I had a fantastic team, and then I started to work with people at West Suffolk Hospital, and they talked about the potential of an early adopter for advanced practice. And so I then joined the hospital to develop that with the team. And I was very much a team player then, rather than leading it. But and that really extended my understanding of patients, the patient journey, and it really did draw on my nursing and my paramedicine, which was lovely. And then I went, and as part of that job, I would often in my timetable have teaching for the FY1s, FY2s, the doctors, or the nurses, things like clinical skills, PIC lines, that type of thing, assessment. And I loved it. I absolutely loved the education aspect. So then I applied and became a part-time lecturer, and then maintained my part-time role in the hospital. And I really, really loved being a lecturer. I realised that I could really have an impact on patient care through education, which it definitely has done. So I spent 12 years in a variety of roles in higher education, across nursing. Initially, I went there to teach the advanced practice, which I loved, and I was part of the acute and critical care team. But then I spent 3 years teaching nursing. So there you go, I was using my nursing qualification there. And then using my paramedic qualification, I then developed curriculum in 2014 for the delivery of a program in 2015 for paramedic science. We also developed a paramedic practice degree sometime later, that was for seasoned paramedics that wanted to upskill their academic standing, and that went really well. And then after that, I left and became, that was after, I think it was about 12 years, Carol, in higher education. Then I went in to become head of education at ESNEFT, which was a bit of a full circle, because I had an office at Ipswich and an office at Colchester. And my office at Ipswich was literally a few doors up on the corridor from where I had my first teaching session as a nurse.
Oh, that's amazing.
So that was lovely. I think the carpets were the same though. So I absolutely loved that. So my responsibility there was for a wonderful team, who continued to be a wonderful team, providing non-medical education. So in my team was allied health professionals and nursing, brilliant team, and delivering education across those sites. That was lovely. But for me, I wanted to understand apprenticeships better. So whilst I was sort of leading teams that were delivering on it, I wanted to feed my soul, Carol, and I was missing that frontline education. So I thought, right, okay, what can I do about that? So I'm now in a role where I'm delivering education on apprenticeships, thoroughly enjoying it. I've been doing it for about a year, and I'm glad I've done it, because I really can understand what it means for a learner to be on an apprenticeship as opposed to a degree route. So that's where I'm at now. Yeah.
Amazing. So thank you so much for sharing that. And I think one thing that was really lovely when we had our conversations before this, we talked about that, you're neurodiverse, and later on we're going to talk about some tips for students that may be neurodiverse as well. So you've achieved this amazing career that covers education, research and leadership. So you're an inspiration, Lee. So thinking about some of the students that ask about becoming a paramedic from nursing, or somebody that's looking to become a paramedic, what key transferable skills do you think you need to become a paramedic? And also perhaps any differences between nurses and being a paramedic. So if you start with the transferable skills you need to be a paramedic.
So the clinical reasoning and assessment, I think having been a nurse, I had a real amazing grounding for what I needed to do as a paramedic, but you still need to learn what it means to be a paramedic, and we'll talk about that in more detail. Communication and compassion. I think, all the wonderful nurses I've worked with, I've been immersed in that, and I've felt that, and I've learned from them about how you deliver compassionate and kind care, and I see that continually on a daily basis. So that's another transferable skill that anyone that's done that in nursing, that will serve them really well. Being calm under pressure. So it's a different type of pressure, but as a nurse, you will understand what it feels like to have patients that are deteriorating. You need to stay calm. You need to communicate with your team well. So that's really incredible transferable skills from nursing to paramedicine. Prioritization and autonomous judgment. So that that completely translates to paramedic world, and I think that's I think we're coming on to some of the challenges, but that is one of the key challenges, really. I think from what I know as working as a nurse as opposed to a paramedic, is that you are in the back of an ambulance. That's your office, and it's you and your partner, and you've got to trust them. You've got to communicate so well with them. And I think honesty and transparency in those situations is so important, because you'll get the best from each other. But yeah, you don't have immediately to hand those teams that you can call on. And team working. If you see me looking to the side, I've thought about your questions, so I've just got a few little prompts. But
no problem.
Yeah, so team working's I think that's the key, isn't it? Really good collaboration, really good communication, and being very, very honest. You mentioned neurodiversity, and I think we're going to talk very briefly about it later, but I think being very honest with yourself is very important as well. What challenges you're experiencing, and getting feedback from others, and that reflective process is so important in any role that we're doing. And I think when you're newer to a profession or newer to care, sometimes you don't. I think you can put expectations on yourself, and I certainly did that are unreasonable. And it is really okay to say, do you know what, I'm not sure, I don't feel confident, or I would like some support. And then that's when all the support will be available to you. But it starts with your communication of that. And I think that's a really important message for everyone. Okay. I hope I answered your question there.
Yeah, you did. You did. I think one of the questions I get asked a lot for registered nurses potentially looking to become a paramedic later is, what is the difference? So are there any clear differences between being a registered nurse and a paramedic? Obviously, they're different degrees. If you could just sort of briefly give an overview of that'd be helpful.
So from my experience, they are very, very different professions. There are, we've just talked about the transferable skills, and that's absolutely right. And a nurse moving to paramedicine or a paramedic moving into nursing, in my view, need to immerse themselves in a full qualification. Because, for example, if you're looking at a deteriorating patient, the patient doesn't change, but the environment does. And the support that's available to you, like I just said, you're in the back of an ambulance. What can you actually do in that situation? And the decisions you make as a nurse will be different to that of a paramedic. And only by immersing yourself in that education and training can you really sort of identify yourself as a paramedic or as a nurse. So for me, whilst there wasn't the option available then for like dual courses that provide dual registration. But personally, and this is a personal view, I would at the moment tread with caution with that. I think there's a place for the dual degrees. I think they're over 4 years. I've interviewed people that have come off those courses, amazing people that have been interested in a role in my last job. But I would say that what I noticed was a bit of a confusion about their identity and where they fit in what they should be applying for. And I think so those courses, while I do think there's a place for them for sure, and abroad, I think Australia provides them really successfully. I think maybe Canada does, but there's certainly courses that have combined a nursing and paramedic qualification. But I think we're very early in that adoption. And my view on that would be that the key for anyone delivering those programs is that they need to get that practice experience right. And what I mean by that is it needs to have the identity of a paramedic or the identity of a nurse. And and I think until you get that right, it's going to be extremely challenging for a learner to step off and be confident in either role. So I think we will see really strong curriculums based around a dual registration in the future. There are some that are available, but what my understanding is that because you've got two regulators, you've got the College of Paramedics, Royal College of Paramedics now, very pleased to say, and you've got the NMC, both of which are looking at their professions and protecting that profession. So they need to ensure that is ensure that the learners are stepping off and they're very well qualified and confident and competent in what they're doing. Yeah. Again, did I answer your question?
You did. You answered it very, very well.
Okay.
So you've sort of talked a little bit about this already, probably with what you've just said, but all roles. So when I'm sort of talking to anybody doing the career pathways on my channel, all roles have challenges. What do you think are the main challenges as a paramedic, and how do you overcome them?
Yeah. So I think you're right. First one I've sort of I have nodded to, haven't I, that that unpredictability of being a paramedic, but you can get that in nursing as well. So there is it's different, and I think that's how I would sum that up. That there are the two different roles, and what I was saying earlier about that. I think what I would say to anybody looking at a move to being a paramedic or move to being a nurse, it's I always advise learners not to get too involved in the politics. Be mindful of it. Be very aware of what the challenges are in your areas, but don't let it overshadow why you've joined. I never did that. So when I joined in the early 90s, we had an all-out strike, and I entered a service that appeared to be in disarray. That was it. Kenneth Clark was calling them ambulance drivers, and they were, there was all sorts of. And I remember going on a march. So we did residential training and education, which I actually think is really good because it really immerses you in it. And I initially went to Banstead in Surrey, and we were pulled out of our training because there was this all-out strike, and the training officers needed to support and go. There was the Green Goddesses as well. The army were in. It was an incredible time. I went on the marches in London, and then I eventually went to Pelsall and completed my training. But the point of that, Carol, is that I could have easily become put off by the profession. I could have, the chatter around the things which were affecting people that were in the service. Of course, be mindful of it, but it didn't impact me in the same way. I hadn't lived that experience. I hadn't earned my stripes, and I just concentrated on my patients and why I was there. And I can tell you a story of why I got into paramedicine, but I never lost sight of that. And so my advice to people would be, there are challenges with any profession. You will hear that conditions could be improved, but support might not be as it should be, and all of that's true. And as I think as a paramedic, the most difficult thing is people need your help, and if you can't get to them, that's really challenging. And it's very easy to blame others, blame other teams, controls, but it's not their fault. We have an NHS that is doing its very, very best in very difficult situations. So I think anyone's interested, have a look at the locus of control. If you haven't looked at that, have a little look at that. What's in your control and what's not? And I think when you're in the back of that ambulance, you've got your patient, you have control of that environment. So be mindful of the chatter, but think about your locus of control and the things that you can change, so you can do your reflections, you can make yourself a better clinician, you can be honest and transparent about the areas that you need more development in. They're the things you have control of. And the politics of it, I'm not saying leave it to others, support the conversations, but don't let it overshadow the work that you're doing.
Brilliant. Thank you. That's really, really insightful. And it shows all the experience that you've got there as well. And you have that global view. So really, something that I'm asked a lot is, how do I become a paramedic? So sort of what professional qualifications and courses do you need? And you might want to talk a little bit about how you got in to become a paramedic, because you might have done it slightly different as well.
So it is different. I did have a little trawl and see what universities are asking for. So I'll tell you my story but but firstly I'll tell you the qualifications and that. So what I've learned from a trawl this week. So for a BSc honours degree, if you're going the university route, UCAS tariff points are normally 112 to 128. So it depends on the provider. You'll normally want a science subject. So that UCAS points would be equivalent to an ABB or a BBC, depending on where you're applying at A level. So they normally like a science subject. I certainly used to ask for that when I was delivering it. They'll accept a BTEC, so an extended diploma in health and social care or applied science, and that's at DMM or DDD. or access to higher education diplomas. That's usually 30 to 45 credits, and they'd want that distinction or merit depending on the provider. The additional thing you would need is to consider is you need a full driving license, and that might be difficult for anyone that's younger, thinking about coming from their maybe further education, and they might not have had the opportunity to do their C1. The class 1 is what you need to drive an ambulance. So it's worth a conversation. I used to have a lot of conversations from people saying I just haven't had the experience to apply for that. So I would often let them come onto the program with the proviso that they would get that in their first or second year, which always happened. So that is a conversation you need to have when you go for your interview, or if you go to the campus to have a look. You'll need an enhanced DBS, which is your disclosure and barring service, occupational health clearance, of course, to keep you safe at work. And they normally do an interview, and some of them do mini interviews. We certainly did that, which is sort of scenario based to get a sense of what you're like in different situations. And then the other route in is your apprenticeship route. So that's an HCPC approved qualification, level 6, and it's delivered between the ambulance service and the university. Generally what it is, normally they want A levels, so BBB or a BCC, including a science is normal. BTEC, again, the extended diploma. They'll accept access to higher education, which is 45 level 3 credits, and they want that distinction or merit. GCSEs, they'll accept English and maths at grade 4 or C or above, and employer sponsorship as well. So you generally people will apply to an ambulance service for an apprenticeship program. Yeah, so sorry if that's a bit dry, but I just thought I'll give an overview of what's out there.
It's really helpful, Lee. I'm so sorry, I've got a really bad cough actually as well
right.
today. Excuse me. It's really helpful because that's what a lot of people are going to be watching that want to become a paramedic will want to know, because it's not just student nurses that will be watching this, it'll be people wanting to become a paramedic. And it's really helpful to know both different types of routes. So the university route academically is harder potentially with having to have A levels, BTEC maybe, than the apprenticeship route to access, but the degrees are exactly the same level, aren't they?
Yeah, exactly right. Yeah, and I would say that anyone that's interested in doing certainly a degree program, I used to welcome people coming to the campus, and I think you absolutely should do that. Go to the open events; they provide them all the time. You'll get subject talks, you'll get to meet the teams, and that university experience is exactly that. You want it to be an experience, and so have a look around the towns, have a look at what the student union are doing and what's being provided by them. Really enjoy it, yeah. And if you're coming from another profession like nursing, then a lot of the programs will accredit prior learning. So that's a conversation to have with them. But I would say, as a caveat, and it's the personal view, I wouldn't APEL too much, because that goes back to what I was saying about the nursing being very different to paramedics. And where I've had people APEL, it's reduced some of the assessment work for them, but actually exploring things with a paramedic mindset is really important. So you don't want to reduce too much of your program. I mean, there is a limit on how much they can APEL anyway, but that would be, if you're going to do it, just do the program, I would say. If that was me, that's what I would do, and really immerse yourself in it.
Yeah, and just for viewers that don't know, because there might be people watching, and I've got a for people watching that have not started a degree, do not have nursing or healthcare backgrounds, just explain what APEL is, because the accreditation university system.
Yeah, absolutely. So
that is, just give us a really simple sort of
so it's a process it's a process that universities will use to consider any experience, so that's prior experiential learning, or accredited prior learning, which is your qualification. So they'll look at your experience qualifications, and they will see if that aligns with any aspects of the program that you're applying for, and whether you can complete that course by taking some of those assessments out. But like I say, that yeah, I wouldn't want to do that, because for the reasons I said, I think and where people have done it, they sort of end up doing the work anyway, because they want to understand it. So, you know, it's very difficult to start taking pieces out of the program, because the programs, you know, the teams will have put an awful lot of thought into what that curriculum needs to look like to get you to that competent practitioner at the end and feeling confident. So if you start taking bits out, it doesn't make sense to me why you would want to do that. But I get it. You know, you might be able to reduce the time, maybe potentially reduce the cost. But yeah, that would be my view.
Yeah. And what made you go in to become a paramedic? Because you started off with your registered nurse degree, and do you want to just give a brief overview of that? Because it'd be interesting for people. Because you did it in the 90s, wasn't it? So it's very different times then as well.
Yeah, so it's 80s.
Oh, 80s, yeah.
Yeah. So who was in Wham? I'm trying to think of Duran, the days of Duran. Yeah. So so my story is this. So when I was 6, my father died unexpectedly. He was 39 years old. And that had a huge influence on my understanding of what care and compassion is. And looking back, I didn't realize at the time, but looking back, that shaped me. And I realized I wanted to be the person that was being so kind and compassionate to me. I wanted to be that person. I hadn't realized it. I was only 6. And then when I got older, I was adopted. And my adoptive father was an ambulance technician of the day.
Oh.
There wasn't paramedics back then. And I was then, you know, he'd be going out to work in his uniform. He even had the cap back then and the blue uniform, white shirt, you know. And, very proud of him, but I didn't really understand what he did. And then I was nursing at that point, and I saw him. We were in our local town, and I saw him turn up it was a lady that had fallen. She was fine, but she'd fallen. And he was in the middle of town, and he got out, and he did all of the things that I remember as that little 6-year-old, the care and the compassion and the kindness. And I remember how he held her hand, and that really I thought, oh my goodness, that's where I need to be, you know? So that was my interest. And then I spoke to him about it completely differently to however I'd spoke to him before. I used to go to the to the local ambulance station. I used to eat their biscuits, and I'd get very excited when they literally had a red phone for the red calls, the emergency calls, and I'd get very excited when they'd go out with their blue lights and that. So I'd been around this but not really understood it. And when I saw Dad caring for that lady, I really understood it. And I thought, you know what, that's what I want to do. He then said, look, if you're really interested, Lee, he said, paramedics are a way forward, and it's coming in. And I think when I joined, there was about 11 paramedics at that time.
Wow.
And so that's how I got into it. Yeah.
Oh, amazing. Thank you for sharing that as well, because it's a really personal story, Lee. So I'm just going to ask you a final question, so I won't keep you too much longer. At the end of these sort of career talks, I always ask, is there any tips you can give for students who are biggest base for watching, or newly registered nurses? So I just, also you mentioned about being neurodivergent, so maybe you want to link to that. I don't know, whatever you think anyway.
Oh, bless you. Yeah, so many tips. I'll be very happy to come back and talk about being neurodivergent in some detail.
Yeah.
So I think that's a good thing. First thing I will say though is, and I do share this a lot, is that it can feel like everyone else has it sorted. You can hear people like me and others on your channel. By the way, there's some amazing people. You must listen to Carol's channel.
Oh,
There are amazing. You know, it can sound like everyone's got it sorted and everyone knows what they're doing and they go seamlessly from one thing to another. But the truth is, we all trip and fall and stumble, and doors open to us. And you know, my career, and it's very nice that you said those lovely things, but you know, I didn't plan that. It sort of doors open for me. So my message there is, you know, if you're young and you maybe just haven't done as well in your qualifications as you hope, don't worry, it will sort out. If you're nursing and you're not, you know, you've become a little bit dissatisfied with it, this is a door opening for you. You're looking now, you're thinking, could paramedicine be for me? Or if you're a paramedic, could nursing be for me? And doors will open for you. It's rarely linear. And when I support students on courses, all students have periods where they're doing great and then they have struggles. And the key, and it goes back to what I was saying in practice, the key for that is communicate it really well. But firstly, be honest with yourself. And so that leads me on to the neurodiversity. So I learned about my neurodiversity in my 40s, and it sort of all fell into place. The things that I had challenges with, by the way, you know, people, I know they overuse the idea that it's a superpower. It's not a superpower, but there's some brilliant aspects of it. I wouldn't want to not be neurodiverse, but understanding my neurodiversity means that it's not as challenging as it was for the first part of my life. So I think my tip there is, if you think that when you sit in front of your computer, you've sat through your lectures and you understood it, but now you can't get it onto the page, seek help. Because it may be that there's aspects of how you're approaching it that academically we can help with, but there might be aspects of that which is neurodiverse and you haven't been picked up. And by recognizing it, you'll get the right support that's targeted for you. And I think the other thing to say about neurodiversity, and I will come back, Carol, I think there's so much I'd like to share, which
that's
hopefully
really kind
will make,
of you.
Yeah, not
Lee,
at
because I
all.
think you're going to be such an inspiration for people. And you know, we've got a lot of students that would really benefit from another bit more talk about how you manage your academic studies. You've had an amazing career.
Yeah,
As somebody that you define yourself with a being
yeah.
neurodivergent.
Yeah,
Yeah.
yeah, definitely. And I think I'll be very honest, because you know, I've had a lovely career, but that's what I've learned is be really honest with yourself, be honest with others, and you will get the support and understand yourself. And I'm still understanding myself as the years go on. And I think, you know, when we talk in nursing terms or paramedic terms about reflection, that is the key to everything. You know, I've had conversations this very week with managers that needed to go through that cycle of reflection. And what we came out at the end with some amazing resolutions and some amazing decisions that if we hadn't reflected on it and been honest about, you know, things that were working well, things that weren't working so well, and how we feel about that and what we can do about it, then we wouldn't, you know, who was it said, definition of madness? Was it Einstein? Or definition of madness is doing the same thing in the same way, expecting different results.
Yeah.
And that's where reflection's so important, isn't it? It's like stop, pause, reflect, be honest, and you'll do okay. Yeah.
Oh, thank you so much. So that's the end. It was lovely talking to you. I really enjoyed talking to you today. And as I said, none of the speakers are paid. So it's really lovely to give lots of likes to Lee's video if you're watching this. And I really hope it helps anybody looking at a career to become a paramedic. But thank you so much for doing this in your own time, Lee, as well.
You're very welcome. Yeah, I hope it's helpful.
Thank you.